who are the patients that I implant with the use of a CanGaroo pouch. And to be honest, like I had said, I was always skeptical of anything that when we first adopted medicine, and I wanted to make sure that it was appropriate and safe for my patients. But after learning more about it, looking at basic science data, which there is robust amounts of, as well as preclinical and clinical data in patients and humans, as well as animal models, that decided to adopt it. But I think it's important that we bring up that the concept of how this pouch works versus a synthetic pouch and other pouches that we previously have used and currently use as well for infection prevention are that because this is a biologic pouch and because it is used to prevent a capsule formation, the patients that are best used with this are ones that are, I shouldn't say best used, but I think it's particularly helpful for de novo implants. And so that being said, implantation in patients for generator changes, the ones that are high risk of infection, there is also a benefit. I do personally try to remove the capsule in patients who come in for generator changes because we think that that's a nidus for infection, and that when we replace the generator, if we take the entire capsule out, essentially you have the same fresh pocket as when you first started. But preventing that from forming in the first place would be ideal. And so I try to take as much of the capsule out as I can and then place a CanGaroo pouch in for patients who need a generator change. Elderly patients, ones I showed that picture of earlier on, they're thin-skinned. Again, we've all seen them. You can see all of the leads. You can see the can very clearly and the outline of it. And I hate doing those generator changes because I know there's just not a lot of tissue between where I close the pocket to the air, to bacteria getting introduced into it, and where the device is. And sometimes, like this picture shows, I may not have the option to put the device deeper underneath the muscle, depending on how much lead is there. And I've inherited some patients that were implanted either elsewhere or by another doc, and unfortunately, I've had patients that come in with the generators in the armpit and they're miserable, or that they have significant pain, or that there's only this much lead and that they're dependent, and it's very frustrating. And those cases, now that I'm doing those generator changes, either on my own patients or ones that I inherited, I am particularly careful about how I do the initial implant because I'm really helping myself and my patient down the line when I have to change their battery or do a lead revision. So those skinny patients, I really wish they had a couple extra layers of tissue. And this concept is basically how we develop that, meaning develop that tissue in between the generator and the outside, where the incision is, the outside world. Obese patients are the direct opposite. Obviously, they're ones that have lots of tissue and lots of tissue that allows the can to move wherever it wants to move. And so all of us who have done these implants where you try to dissect through the plane to open up where you are going to put your generator, it just cuts right through and the can move wherever it wants. And so if that generator is not tacked down to muscle or something to keep it from moving, it's going to move, it's going to cause the patient pain and or dislodge the leads, and then you got to go back in there and fix it, which is something that we never want to do. And so I think for these patients it's particularly important. Younger patients, they, again, of course, everyone does care about what their device looks like, but in particular, younger patients, they're going to have to live even longer with this device. And so not going into that pocket as much as possible is important, and making sure that it's healthy tissue for them long-term is important. Subcutaneous ICDs or SICDs, I think, is a no-brainer. I think that every patient should have a CanGaroo pouch who has this at a minimum. And the reason is that there's multiple, which we'll talk about in a little bit, but defibrillation threshold is particularly important for SICDs, and location, because it's not in the heart itself, is important. Now, I had a young, very sweet teacher who was in her 20s who I implanted an SICD in years ago prior to my utilization of CanGaroo. And she was quite obese, so it was very difficult for me to close the incision. I spent lots of time doing it, but despite my best efforts, her generator moved. Essentially what happened was the can flipped upon itself, it pushed right up through the incision, and the wound dehisced, and I had to remove the whole thing. And I felt horrible about it, and I still remember it to this day. And those are the kind of cases that if you can do something differently to prevent that from happening, that's kind of the most important thing that we can do. And that's what I learned from. And so I wish I had this then, this was years ago, to be able to prevent that. So I think the generators are bigger for SICDs, which we all know. So you either have your really skinny patient or your really big patient, both of which would benefit from this. And the last subset are people who are at risk for infection, and so in particular, immunocompromised patients who have diabetes, who are undergoing chemotherapy, who have a suppressed immune system. Anything to promote wound healing is important. And then dialysis patients are always at the highest risk because of the continuous access of their bloodstream. And so I think that all these patients are potential um, candidates that could benefit from a CanGaroo pouch. But again, over the course of my work with these patients, I really do use these for all de novo implants because I think that it's particularly helpful. And anything I can do to minimize any of those complications I referred earlier is important to me and important to my patients. And so who do I use it in? I try to use it in everyone if at all possible. And honestly, I have a conversation with the patient. And so I think that that's important. It's not necessarily something I did before. But again, seeing that that one picture on the end where the patient's device is already eroded through the skin is something we never ever want to see. So anything I can do to prevent that, of course, is important for all of my patients. And so I do tend to use this pretty frequently because I think that it is particularly helpful for them.